This is Module 25, the concept of development. And here are your learning outcomes or objectives. So when we talk about development, we're talking about actual growth, physical growth, or the increase in size of the bones, the height and weight, dentition. Development refers to the increase in complexity of functioning and skill progression to be able to adapt to the environment. There are several principles of development. I've tried to weed a lot of these out of your book because they go through so many different theories. So first of all, principles. Development is usually continuous, it's orderly, it follows a sequential process. All humans follow the same pattern, although it may be at a different pace. Sequence of each stage is predictable. Each development stage has its own characteristics, and depending on what theory you're looking at, they may be worded differently. All development is cephalocaudal to proximal distal direction, meaning head to toe and from middle outwards. So, for instance, the arms to the fingers, developing grasping motions before developing fine motor skills. Development proceeds from the simple to more complex, becomes increasingly differentiated. There are certain stages that are more critical to others. The pace is uneven. Like I said, sometimes it takes somebody more time to develop in a certain stage than another person. So the rate is highly individual depending on the person. So there are theories of growth and development usually contain 5 components. Psychosocial development, the ability to interact with others. Cognitive development is the thinking as the brain continues to increase in complexity. So behaviors, functions, ability. Moral is the ability to reason as sense of right and wrong. Spiritual is developing an understanding or belief in a higher power. And the biophysical is the expected growth. We talked about growth and development. So the body systems continue to grow and mature. Your book does introduce 7 different theories of development. In nursing, we use Erikson's 8 stages of development as outlined here. These are levels of achievement and tasks that need to be completed before moving on to the next stage. When you're looking at Erikson's 8 stages, which I'm sure that you have seen this before, don't rely on the age as being where somebody should be in their development, but rather look at what tasks need to be completed before moving on to the next level. There is an increase in complexity going from trust versus mistrust to integrity versus despair. And also just remember that somebody's developmental stage or your assessment of their developmental stage may be situational because people will regress when they're ill. So some genetic considerations, physical characteristics like skin and eye color we can't change. Gender, for the most part, we can't change. Temperament is a combination of biological, physical, personality behavior. And we have 46 chromosomes, our sex chromosomes, and the autosomal chromosomes, giving us our personality types, our intellectual potential. Development through the lifespan. Some changes are very subtle. They're very highly individualized. Other development changes are very apparent and represent milestones. We're not going to get into details of those for the infants and children, because you will get that when you have pediatrics and maternal child health. We're going to look at young adults, ages 25 or 18 to 25. They are in the peak of physical development. Psychosocial stressors such as relationships, education, employment. Physical assessment, we talked about how we're assessing normal, healthy adults. And health history. Middle adults, 40 to 65 years old, again, similar to physical status function to that of a younger adult, except that typically they are a little more established when it comes to their relationships, to their employment, and things like that. Physical assessment, you know how to do. Their health history is going to be a little longer. Older adults are further divided into 3 different groups: young old, middle old, and old old. So the population that's increasing more rapidly than any other age group is the older adult, and especially the old adult. So we talked about normal physiological changes when we talk about each system. For instance, we talked about skin turgor being not elastic in an older adult. Alterations from normal, using developmental theories in order to assess something that is a alteration or deviation from normal. We are using developmental theories to guide our assessment. There are going to be tasks that are specific for ages. There are going to be individual variations. We want to explain behavior using these theories. And these theories also provide direction for nursing intervention. So if we notice a developmental delay in any area, the sooner we can get interventions begun, the quicker the outcomes. Developmental disabilities are a cluster of conditions that can occur as a result of impairment, either alteration in physical function, language development, behavioral patterns, learning ability, and alterations can occur at any point in development. So prevention. Educate pregnant client about proper nutrition and avoiding harmful substances. Help parents achieve a healthy parent-child interaction and relationship, and stress the importance of safety throughout the lifespan. Some other non-modifiable risk factors for developmental delays and problems are chromosomal disorders, premature birth, multiple gestation, and low birth weight. Some modifiable risk factors. Prenatally, we want to make sure that we are talking with mothers about their nutrition, smoking, alcohol, drug use, prescription and non-prescription, maternal illnesses, their own self-care. Do they receive vaccines, flu vaccines in particular, and are they at any risk for injury? Environmental factors we want to look at. We want to look at the family characteristics. Do they have adequate nutrition? What's their socioeconomic status? Do they have access to prenatal health care? And also illnesses, making sure that they are not exposing themselves to illnesses that could cause problems with the fetus. So developmental theories, like I said, help nurses to encourage client behavior that's appropriate for the particular age. It helps with planning interventions for children. It gives adults anticipated changes. Developmental milestones, like I said, you're going to get those in when you have your pediatric course. But what we want to do is compare expected findings and assessment results with what the norms are. Lifespan and cultural considerations. We want to look at nutritional practices. Different cultures have different views on breastfeeding, different diets. There may be different foods available. There may be different norms of when you introduce certain foods to a child or an infant. Child rearing practices. One of the examples in your book is how some cultures carry their infants. They papoose them either on the front or the back. They have less incidence of hip problems. Traditional practices. Cultural groups have rules for social interaction, such as the social roles of men and women. So that may be a consideration. Genetic abnormalities equal stigma, and this is very true in poor socioeconomic areas and those who have limited resources to health care. So one thing to remember also that goes along with culture is developmental screenings for children are not culturally sensitive, and they may label a child as being delayed rather than a different pattern. So certain traits are common to ethnic and cultural groups that may predispose children to be at an upper or lower range of growth, and that may negatively influence the assessment. So we want to be careful that we are looking at their culture. We're looking at where they are developmental relating to their culture. So that is it for the concept of development.